Hi everyone, this is Susan Hertzberger in Straight Talk About Old Age. This is chat number 11, Geriatric Immunology. You may think of immunology as that specialty that deals with allergies and vaccinations, but the range of issues has largely expanded as the population has gotten older. Allergies may actually be better among older people, but then there are other factors that come in, such as emphysema and more infections. Immunology deals with cancer, it deals with autoimmune diseases, including 100 different kinds, and it deals with infections. 1 out of 3 people over 65 actually die of infection. Why are older people more at risk for this? One of the reasons is the settings they live in, and these include nursing homes and hospitals where people are more at risk for infection. They receive chemo and radiation and steroids. All of these things make a person more at risk for infection. Also, they have implants and they wear dentures, which increase their risk. Those people who are not moving, are functionally impaired or stuck in bed, have a much higher risk of developing pneumonia. Identifying that a person has infection, an older person has infection, is tricky. Only 1/3 of elders actually launch a fever. So their symptoms may be change in functionality. They aren't up to doing their usual routine. They may be mentally cloudy, or they may be suddenly incontinent of urine. Another thing that is common in older people is this post-viral syndrome. So after having an acute bout of flu, they may be persistently weak and unable to walk for several weeks. There are different kinds of infection. One is chronic. This could be in the mouth or the sinuses or the body folds. Could be in the nail beds, on the feet. People are commonly colonized with bacteria in their bladders and in their bowels. And you probably have heard about superbugs that cause diarrhea, and people coming into the hospital may be carriers of that, although they may not have symptoms of an acute infection at the time. Some of these are due to chronic or overuse of antibiotics. So this is presenting a big challenge for people in the hospital, and oftentimes people are tested on admission to make sure that they don't require isolation to protect the other patients. Then there are acute infections. Cellulitis is something that requires antibiotics, often or usually intravenous antibiotics, and this could be cellulitis of soft tissue in the legs, around the eyes, just about anywhere. Shingles is another acute infection, and the thing with this is that post-herpetic neuritis, a very painful lingering condition after the shingles has passed, occurs 20 to 50% of the time and can persist for over a year. Then there's severe flu or diarrhea, the most common type of infection, which brings its risk of dehydration and electrolyte imbalance and cardiac arrhythmia. Prophylactic antiviral medicine is given in facilities such as long-term care facilities if over 10% of the people are ill or there's a new flu strain that's responsible. Another kind of infection is called opportunistic, and this is when the immune system gets weak, either through natural aging or some other reason. Old infections resurface, and this could be tuberculosis, it could be any number of herpes type infections. Cytomegalovirus is a very common one. 87% of women over 70 have this dormant cytomegalovirus that pops out when their immune system becomes weak. People with chronic fatigue syndrome, people with HIV/AIDS, and people who are frail often have these opportunistic infections that come and go. They're like cold sores that pop up when you're under stress. The field of immunology is a very exciting field because there's a lot of research going on. Some researchers are trying to figure out how to boost the immune system. Others are trying to figure out how to attack the infectious agent. This is something that I am personally interested in, and we have lots of questions, but not a lot of answers at this point.